Today's Ask the Doctor segment is all about ankle injuries. Dr. Kavita Iyengar is an orthopedic surgeon from Brookwood Medical Center, and she's here to answer your questions. So you can give us a call, 741-9272. The phone lines are open right now, and we appreciate you being with us today. And what are some of the most common injuries that you see as an orthopedic surgeon, I guess, in regards to ankles?
Yeah, probably our most common ankle injury we see are ankle sprains. Those tend to be very common, actually, in our population. So,
what's the, I guess, method of treatment? Does it vary based on the sprain and the severity?
Yes, there's different grades of ankle sprains. So you can go from a very mild case, which generally people tend to walk it off and move on, and then there's the more severe ones, which tend to come in and people get seen for that.
And could some of the sprains lead to surgery? They can
on occasion. Not when you look at all of the ankle sprains we see, not many go on to surgery, but some can.
What's the difference between a sprain and a break?
A sprain is more of a soft tissue injury, more with the ligaments and the soft tissues around the ankle. A break involves the bones themselves.
And I guess how could someone at home who might have injured their ankle, how can they tell the difference between a sprain and a break?
It's a difficult thing probably for one to know the difference when you're first injured, because the signs and symptoms are very similar. You have difficulty walking on the foot, you have swelling, you have bruising, so you have all very similar signs. Generally the sprain, if it's a mild enough case, will subside with time, but obviously the break is going to continue to hurt quite badly.
I can imagine. We have a caller now, Vicky from Bessemer. Thank you for calling. Vicky, what's your question?
Yes, I took a fall Sunday, and I was able to get up and walk afterwards. But once I got home, my ankle, I couldn't really put any pressure on it, and I'm just wondering if I needed to go to the ER. I did the alcohol and the an ice pack and ace band, so I really don't have any much swelling, but I just can't put pressure on it.
Yeah, so that's an important distinction to make. The fact that you're unable to put weight down on the extremity makes it a little worrisome that something more than just a sprain or a mild sprain is going on. It'd probably be smart now that we're a couple days into this to get further checked out.
Thank you.
Does that answer your question, Miss Vicky?
Yes.
All right,
yes,
thank you for calling. Next up, we have Johnny from Hoover. Johnny, thanks for calling. What's your question? Johnny, can you hear us?
Oh, yes, I'm sorry.
That's okay. What's your question?
Last week I was walking toward my kitchen and my ankle gave way and my foot across the top of it just folded under my leg.
Oh.
And somebody said it was like a drop foot. I've never heard of it before. But do you know anything about that?
Drop foot's a pretty specific condition where you're having a tough time bringing your ankle up, bringing your foot up, and it seems to be dragging on the floor as you're walking. Kind of pretty rare to have it with an injury like you had, but it's something. If it continues to give you trouble, it might be something to get looked at, just to see what that swelling's all about too.
Miss Johnny, are you still in pain? Do you still have some pain associated with that fall?
Yes, I still have pain, and I favor it. I can't put pressure on it right now.
Yeah, so this is probably something that would need at least an X-ray at the very least to make sure nothing is broken, and an examination to see if there's any sort of sprain in the foot itself.
We hope you get to feeling better. Miss Johnny, did that help?
Does that have anything to do with it?
I'm sorry, what was the last thing you said, Miss Johnny?
I'm 52. Does it have anything to do with
52.
it?
She's 52.
Oh, no. I think you had an injury. You had a giving way episode where your foot gave way under you. So I think that has more to do with it.
We hope you get to feeling better, Miss Johnny. Thank you for calling. Thank you to all of our callers, and Dr. Iyengar, thank you for being with us today as well.
My pleasure.
All right, well, stay with us.